Busy yung papakita ko. Sorry, naging busy ako. Uy, kita niyo ba ako? Naging busy ako dahil dito. Tignan niyo yung delivery sa akin. Ganda ng table ko! Hindi na awalis ng kama ko! Ganda ng table ko! Oh, pangkama ko! Hindi na ako aalis! I will never leave my room. Ganda ng kama ko, diba? Ay, ang ganda ng table ko para sa kama ko. I'm so happy. Kaya po ako nagtagal kasi kinuha ko pa yung delivery ko sa labas. Shit, ay shit, hindi ko
Hello po,
nakita
good
to.
afternoon.
Ano
Kamusta ang mga
ba?
Bibo kids?
Happy sa 11-11 Shopee Hall.
Nakarami. Um,
Ang kapal ng mukha mo, pero marami akong utang.
siguro
Si
nga.
JP pinakamalala yan eh, ng PS5.
Wala na po yung admin, bukas na lang. Ginawa ko muna para.
Ano daw?
Andito ako sa cafe. Dito na ako magkaklase. Oo.
Anong PS5? And I have face mask. Yan talaga mga hinol ko in this lifetime. Isang box ng face mask.
Ang dami naman yan. Umabot kaya ng time ng, nung nag-start yung pandemic, naging 1,000 plus, di ba? Grabe yun.
Yeah! So, hintay ko siyang bumaba yung presyo.
Ngayon, 50 pesos na lang meron. Kakaloka.
Oo. Yan.
Oo.
Totoo din.
Ngayon, 10 pesos na lang.
Binaba. Inintay ko nga bumaba para makabili ako. At hindi ko na charge sa pasyente ko.
Wow, naman.
Siyempre, no, ilan na yung nagalit sa akin kasi daw nag-charge kami ng face mask.
Pati,
Siyempre, sa nurse magagalit yun. Saan pa ba magagalit yun?
pati face mask, china-charge sa patient.
Yeah.
Grabe.
Siyempre, di ba, ayoko na mapagalitan. Kanila na lang yun.
Ayan. Ano ba? Upon checking po yung yung mga nasagutan nyo last time, may isang hindi sumagot. Sino kaya yun?
Ikaw siguro na, Jack. Ako sumagot ako.
Ayun. Ah,
Ay, meron ata ako screenshot. May question pala ako dun.
sige, sige.
Bibukid talaga eh, no?
Bibig.
Teka lang, hanapin ko. Asan na ba yun?
Sige.
Ay, start na ba tayo? Asan na ba yung
Sige lang, sige lang.
mga checker?
Tapos may mga i-share din ako na mga questions kasi nakuha ako as NCLEX educator din sa Australia ngayon. So, mayroon kaming mga materials na ginagamit. So, i-share ko din sa inyo para
Theoretical knowledge.
guilty.
Asan
Guilty
na
si
yun?
Kuya Chuck.
Ito, number 15, walang answer.
Ay, wait lang. Number 15.
Yeah.
Kaka-answer lang ni Nag-check ako kaninang mga after lunch. Anong oras ka sumagot, Kuya Jox? Check ko nga. Okay. Late na yun
Ayun. Number 15 yung walang
yung walang answer. Sige, wait lang. Check ko lang.
Bibo kid.
Number 15. Tapos tinry niyong i-time yung sarili ninyo kung mga ilang seconds nyo nasasagutan yung isang question.
No.
Oh.
Kasi ginawa ko yata siyang in pieces. Kasi nandun ako sa bahay ng pinsan ko. So, paputol-putol ko siyang sinagot.
Tapos tinry yung i-browse yung mga sinend ko na materials or hindi pa?
Ako wala pa.
Yung sa Funda, yung PDF file. Nandun siya sa
chat ni JP. Ano ba sinachat
nandun
ni JP?
siya sa Funda Materials, Funda Concepts.
Ako, honestly, hindi ko pa po na-browse.
Okay. So, number 15, ayun. Number 15, planning is a category of nursing behaviors in which ang answer dito ay anong answer po dito? Number 15.
Letter C.
Yes, correct. The answer is letter C. Client-centered goals.
Plus
Ayan.
1, pero hindi pa rin ako pumasa.
Oo. Oo, hindi ko siya nalagyan ng answer.
Ano ba yan? This is so sad. Hindi pa rin ako pumasa.
Tanong ko nga lang po, kailan yung target nyo na mag-take ng exam? Kasi yung next na free time nyo, Friday, 'di ba? Para sana matapos na natin yung Funda concepts. Kasi dun sa maternal nursing, medyo madami din siya. Normals and abnormals kasi eh.
Oh, I hate
Oh,
that.
next year, next year, 'di ba?
Next year, di ba?
Next
Oo,
year.
kasi ang tagal ng process ng papers. Di ba, Jax? Wala pa yung mga papeles ko. Pinalakot ko yung sa PRC ko. Oo, next year. Sabay-sabay ba tayo, JP?
Sa Australia pwedeng makapag-book na ng exam basta nandyan ka. Kasi yung mga estudyante ko from Australia na mismo eh. Tapos magte-take sila ng exam on December 11 daw.
Oh, next year din daw si JP, oh. Hindi, next year din daw siya. Sabi niya. Ayan, oh.
Next year din. Okay,
Oo,
sige.
sabay-sabay tayo para pare-parehong anxious. Ganun. Oo, para happy, diba? Lahat tayo kabado, lahat tayo hindi ko Wait lang, makikita ba agad yung results? Parang UK, ganyan.
Wait na.
Ano ba yun?
Tapos
Few hours,
nung chinek, yung
Pag yung NCLEX ba, para ba siyang parang UK na parang ilang hours lang, tapos kita na yung results, ganun.
Hindi, mag-aantay ka ng ilang days bago i-release. Oh, pero may mga ginagawa yung mga exam na kapag nag-try sila na mag-open ng site tapos magbo-book sila ng panibagong o kunwari tatry lang nila mag-book ng NCLEX examination. Kapag sinabi doon sa site na you're not allowed, ganyan. So parang ibig sabihin nun, passed ka na. Ganon. Oo. So, usually, days bago na i-release yung result ng NCLEX examination. Meron, ano na to? Sige, share ko na lang din mamaya yung basahin nyo yung sinend ko sa inyo na Saunders na 8th edition. Yung introductory part niya, basically nandun lahat ng mga details about NCLEX. Ganon.
Oh my God, nag-cut. Ako ba yun? Internet ko ba? Am I moving? Okay, I'm moving.
Ayan. Okay, so, do you want to know your scores?
I hate to see the second one. It's like 20-something lang ako. Parang gusto ko nang, Diyos ko, ayoko na nga sumagot. Ang tagal nga bago ko sinagutan yung pangatlo. Kasi na-stress ako. Okay na yun! Ako, ayoko na.
Try nyo na lang ulit na na sagot-sagutan nyo lang ulit yung yung mga questions para ma-familiarize kayo. Mm-mm. Para saan? Kasi ang next na meet up natin this Friday, 'di ba? So meron ba next week? Friday ata. Oo nga
Uy,
kung kailan
nag-send
siya.
ako ng schedule. Ano ba yung sinend ko? Until this week na lang ba yun? Oo nga, no. Sa Friday, magsisend ako ng panibago. Ay, shucks, hindi pala ako duty. So, Saturday, magsisend ako ng panibago.
Okay.
Pag na-release na sa Friday yung schedule namin.
Sige.
Oh, thanks ha. Every 2 weeks po release na schedule ko. So, Sabado malalaman ko. Baka ma-move na kami sa night eh.
Okay. Sige. So, start na tayo. Tapusin natin yung discussion ng last time. Actually, wait lang. Pakita ko lang, ito, na-browse nyo na po itong sinend ko na Funda material? Or hindi? Okay. Sige.
Hindi po.
So, basically, ito na kasi yung pinaka summary ng fundamentals concept. So, basahin nyo na lang. Tsaka sa fundamentals in nursing concept naman, talagang purely basic siya. Tapos, yung mga questions more on more on application or dapat alam mo yung mga standards. Kaya dapat ma-familiarize po tayo lahat doon. So like for example dito, ano ba yun? Eto, the fundamentals of nursing consist of the following. So, kasama dito yung cultural diversity, ethical and legal issues, kasama dito yung mga consent, ganyan. Leadership and management issues, basic pharmacology, which includes the following: herbal medicines, computation, IV, and blood transfusion therapy, asepsis and infection control, na-discuss na natin to, normal values. Alam ko may sinad na ako sa inyo na table for the normal values. Nutrition, which includes the therapeutic diets, positioning, and diagnostic tests. So, yun. So, dito sa eto, mga introductory statements about the NCLEX examination. Tapos ito, dapat ma-familiarize po kayo dito. Hindi ko na siya i-discuss, basahin nyo na lang po yung dito sa cultural diversity. Ayun, kasi may mga questions na naka-state sa NCLEX examination na you have a patient who is an African American, ganyan. So, dapat how are you going to address these kinds of patient, mga ganun. So, dapat familiar kayo na kapag nag-handle kayo ng African American, touching another's hair is offensive, mga ganyan. So, they believe that illness is caused by demons or spirit. And yung pinaka-distinct dito sa kanila, direct eye contact with authority is viewed as rude. Ganyan. So, kapag nagtinginan kayo sa mata, ganyan. Di ba usually mga Muslims ganun din. So, they don't usually look at you sa, di ba, mata sa mata, ganyan. Kasi they view it as a rude. So, yun yung mga African Americans. And for the Native Americans, for them, silence indicate respect for the speaker, and eye contact is actually a sign of disrespect. Okay? However, here in our culture sa Philippines, 'di ba, pag hindi nakatingin sa yung kausap mo, parang ibig sabihin na hindi ka interested dun sa kausap mo or sa sinasabi niya. And for them, illness is caused by supernatural forces and disequilibrium between person and environment. For Asian Americans, ito, direct eye contact with authority is viewed as rude. And for them, illness is believed to be an imbalance between the positive and negative energy forces. And dito, dalawa na yung mga Chinese, right? So, they promote healing by yin and yang principle. So, yung mga cold foods, yin, hot foods, yang. Tapos, mostly Asians believe that if you are a person who is a very positive or optimistic person, parang mas malilesen yung mga occurrences ng mga illness or diseases sa'yo. Pero pag ikaw ay very negative or pessimistic and you always view yourself as a person na parang iniisip mo lagi na may sakit ako, ganito. So, parang mas lalo siyang magkakaroon. So, ganun yung mga Asian Americans. And even Asians din, may ganun, di ba? For the Hispanic Americans, yan, they do not admire a child and they believe that you may afflict the child with evil eye, mga ganyan. So, they avoid eye contact with authority to show respect, and they actually use embraces or handshakes, okay? And they are very tactile. However, in our situation right now, di ba, itong mga embraces, handshakes, hindi na siya ina-allow, okay, to prevent the spread of to prevent the spread of yung virus. For the European, yung white origin Americans, for them, eye contact indicates trustworthiness, and they primarily depend on modern Western healthcare services. Kaya makikita nyo yung mga Americans, they are actually very, parang sobra silang they are an advocate of herbal medicines as well. That's why if you will look into a lot of herbal medicines and supplements, most of them are really coming from the USA. That's why later on in our discussion, I will be presenting to you a lot of herbal medications since these are very common in US. And in the NCLEX examination, this is purely US based, kaya dapat familiar din po tayo doon. And for the Jehovah's Witnesses, very basic to na alam natin since then na for them, blood transfusion is really not acceptable. Ayun. So, Okay? Eto, mga must knows na lang din po yan. Basahin nyo para hindi natin i-ano. Yan, for Islam, so yung prohibits pork, ganyan. Lumalabas kasi po ito sa ano sa examination. And meron din ditong short quiz, try nyo answeran. Pero wag niyo munang ibaba yung ano na to, yung yung PDF file kasi after nun, andun yung mga answers sa baba. Yan. So, wag niyo munang tignan yung answer. Mag-atat, ganyan. So, for the ethical and legal issues, kasama yung mga advanced directive that includes yung living will and durable power of attorney. Siguro po hindi na natin to discuss, no? Very self-explanatory naman na yan. Parang review lang talaga to kasi na-discuss naman na to noon. Or ano po sa tingin ninyo? Ayan. May mga questions na lang ako na i-post para ma-answer po itong mga 'to. Yan, basahin niyo lang yan. This is purely parang descriptive kasi siya, eh. And in here, yan, meron silang yung Good Samaritan laws, ano ba yung floating, what is clarified, unclear, or inappropriate physician's order, yan. So in cases na hindi po clear yung um mga orders, what are you going to do as a nurse? You will clarify the order with the physician who gave the order, or you may contact the nurse manager or supervisor if no resolution occurs regarding the order in question. So, floating, it is acceptable and considered as a legal practice. Okay, in here, nurse cannot refuse to float, but the nurse should not assume responsibility beyond level of experience or qualification. So in the US, very very pertinent sila or very specific sila with regards to the scope of practice. That's why you will also be able to look here or in the Saunders yung mga scope. For example, ikaw ay LPN, ikaw ay ikaw yung licensed practitioner, prac, license, practical nurse, ganyan. So iba rin po yung iba-iba yung mga scope per category. For the Good Samaritan laws, these laws encourage healthcare professionals to assist in emergency situations without fear of being sued for the care provided. Ayan. Ano ba yung informed written consent natin? So, in here, physician, not the nurse, is the primary responsible to secure written consent. Okay, take note, physician. Okay, physician po and hindi tayo yung mainly responsible in securing the consent. So, siguro po, yung mga nasa clinical area, may mga iba kasi like yung sa akin may na-experience ako when I had my clinical rotation na tumawag lang yung resident doctor dun sa head nurse sa ward, and then sinabi niya ikaw na mag-secure ng consent. But as per theory, since in the NCLEX examination, this is purely theory-based. Kaya nga po minsan nagkakaroon ng discrepancy din kasi, di ba, iba yung ginagawa sa area, tapos iba naman yung nasa theory. But in the NCLEX examination, take note that we will purely rely on what is the standard or what is really written or what is stated in the book. So in here, take note that the nurse may sign as a witness, but the nurse should not secure the consent kasi it is actually the role of the physician. Okay? And for the written consent to be in order for this to be valid, okay, the person should be of legal age. And in here, he or she should be 18 years old and above, and the consent is secured without force, duress, or coercion. Hindi dapat siya pinilit para mag-sign doon. And the person is not under the influence of drugs or alcohol, is not mentally incapacitated, and in here po, parents or guardians can sign for minors and persons who are physically or mentally incapacitated. And minors who are married or emancipated from the parents or those seeking for treatment for STDs can sign an informed consent. Okay, take note po ito. And written consent can be waived in time of emergency to save the life of the person. So mga life-threatening situations, yun yung mga instances na pwedeng hindi mag-sign ng consent yung pasyente. And validity of the informed consent, take note, is for 24 hours only. So if the procedure is postponed, it is very important to secure another consent. Maalala ko parang ito, NLE question din siya. So, how long will the informed consent be considered as valid? So, based on standards or based on the on practice sa ano natin, within 24, I mean, for 24 hours lang siya valid. Okay? And take note that in every procedure, consent should be there. Okay? Kunwari may dalawa or tatlong gagawin sa kanya na surgical procedure, kailangan tatlo rin yung magiging consent na ma-secure ng physician. Okay? For the organ donation, age requirement is 18 years old and above before signing a form for organ donation. And informed choice to donate an organ may be through written document signed by the client prior to death, a will or a donor card or an advance directive. Yan. So, ito very popular ito sa US, yung pagkakaroon ng advance directive. And in here, family member or legal guardian may authorize organ donation if the client is already dead. Okay? Basta first degree. Yun po yung nakastate din sa book. For the physician order, nurses is duty bound to carry out a doctor's order except when the nurse believes that the order is inappropriate. Okay? Nurses who carry out inaccurate order is legally responsible for his or her action. Yan. Okay, for telephone orders, ano po yung mga important dito na details? Date and time of entry, kung anong oras mo siya na-carry out, kung anong oras siya na i-order sa'yo. We should read back the order to the physician and record the order, okay? Also, sign the order beginning with the telephone order, okay? And then write the doctor's name and then sign the order. Once na sinabi ng physician, ulitin mo ulit siya and then um, you will ask for the physician to countersign the order within the time frame based on the agency policy and usually 24 hours. Wala naman pong sinabi sa book kung ilan talaga, kung ilang hours talaga dapat niya masignan once na nagbigay siya ng telephone order. But according to Saunders, ang sinabi niya talaga, this is based on agency policy kasi iba-iba ang policy per institution. Sa inyo, Ma'am Jess, pag telephone order, kailan siya dapat masignan ng doctor?
Dapat talaga 24 hours. Pero, hindi naman nila sinasignan.
Yun din.
Pero nilalagay na lang namin doon kasi na phone order. Tapos, andun na rin yung signature din namin sa tabi.
Oo. Pero minsan may hindi nagsasign, no?
Kasi
diba?
minsan hindi naman nadadaan yung consultant or yung mga tipong paalis na yung patient, ganyan. Tapos may pahabol silang take-home orders, ganyan. Itatawag na lang nila yun. Ganon.
Ayun. Kaya doon nagkakaroon minsan ng discrepancy sa practice, clinical practice, and sa theory. Kaya, yun, lagi ding nire-reiterate na sa NCLEX examination, theory-based talaga siya lagi. So, yung mga nasa clinical area, wag po tayong mag-base din sa kung ano yung nakikita natin. Ganyan. And for the use of restraints, written consent is needed coming from the relatives or significant others. And secure consent for each episode of application of restraints. Okay? So, hindi, kunwari, siya ay, ano na 'to, yung pasyente kailangan mag-dialysis pero, talagang, ano 'to, nagre-refuse siya or kaya, kakaiba yung movement niya, so we should still secure a written consent, okay, from the relatives or significant others present. Okay, for, PRN order, what is PRN? Anong meaning ng PRN?
As needed.
Oo, as needed. What does it, I mean, this is a medical abbreviation which stands for,
Uh,
this is a Latin, right?
hindi ko
Latin
alam.
term. Yeah. So this, yeah, okay. So this, or PRN stands for pro renata. Pro renata. Yan. So, pro renata. And this is, legally unacceptable. Okay? So, in the application of soft restraints, yan, kailangan pa rin po na mag-secure tayo ng, ano to, ng consent pa rin. Okay? And check the restraint application every 15 to 20 minutes to check for the circulation. Okay? Kung baka naman sobrang higpit which would now impede the circulation of the patient. Instead na mag-provide ka ng safety, mas nakapag-create ka pa ng harm. Okay? And you should release the restraints every 2 hours for 30 minutes and change the restraints every 24 hours. Now, for the documentation, for a narrative documentation to be, um, ano to, para masabi na talagang nurses documentation yun, it should be accurate, complete, factual, and objective. And use a black pen. And in here, ano po yung mga dino-document natin? We are documenting the care provided, the medications, di ba? Carrying out the medications, treatments, procedures as soon as possible after completion. Okay? We are also documenting responses to the interventions and documenting the consent for a refusal of treatment. For example, a patient needs to take a specific medication. Okay? However, he or she doesn't want to take it kasi sinasabi niya nakakasuka or sobra na yung mga tinitake ko, so we should still document that one. And document calls made to the other healthcare providers. Okay? Usage of appropriate abbreviations is accepted, pero yung ano lang, yung based on standard na talagang ginagamit, mga medical abbreviations. May mga accepted tayo na medical abbreviations na kailangan, na accepted siya for the documentation. Okay? In case of error, yan, draw one line through the error and initial, write your initial and the date. Okay? And sa clinical area, ang ginagawa natin, we are just, yung iba ginagawa nila, white ink, ganyan. So, di ba, hindi naman talaga siya acceptable. Okay? May mga iba ang ginagawa lang nila, kasi hindi naman nag-chart rounds. Hindi, okay lang. Kapag nag-chart rounds naman yan, bina-browse-browse lang, ino-open-open niya lang yung pero hindi naman talaga niya chine-check one by one, ganyan. However, with the advancement of technology, most of our charting right now are purely electronic na, di ba? So, Ma'am Jess, sa hospital ninyo, purely electronic kayo? Pati sa charting or paper and pen pa din?
Hindi pa. Paper and pen pa din. Pero yung full
Okay.
na electronic kasi, parang within the month yata parang within the month papalitan lahat yun ng pure electronic eh.
Wow, oo. Talagang huli na talaga ang Philippines, no? Kasi sa abroad talagang nag-start na sila even before talagang purely sila electronic na. Kaya nga ngayon, marami na rin daw mga endless questions na may nursing informatics, yan, nursing informatics, tapos meron na rin siya, marami din daw research questions. So, yun yung mga updates. And take note that you should not document for others or change documentation for other individuals. Yan. For computerized documentation, use only the user identification code, name, or password, and maintain privacy and confidentiality of the documented information printed from the computer. Yan. Yun kasi yung issue pag electronic medical records, pwede siyang ma-access, okay? Pero marami pa rin naman mga system, yun yung binabayaran ng mahal ng mga hospitals, 'di ba, yung mga IT system kasi talagang very ano talagang when it comes to privacy, hindi mo siya basta-basta ma-access, ganyan. For the principle of confidentiality, yan, information about a client should be kept private. And information in a client's record is accessible only to those providing care to the client. So, hindi pwede na, for example, you have a patient na postpartum and then her husband is a doctor. So, hindi ibig sabihin na, I mean, hindi porke doctor yung husband niya, pwede na niyang ma-access basta-basta yung client's record. So, these records are only accessible to those who are providing direct care dun sa pasyente. Ayan, and no one else is entitled to that information unless the client has signed a consent for release of information that identifies with whom information may be shared and for what purpose. Okay? So discussing clients outside the clinical setting or telling friends, mga chismis, ganyan. So, hindi rin po siya allowed. Yan. The client has a right to review the records pertaining to his or her medical care and to have the information explained, okay, as necessary. Okay, except when restricted by law. Kaya nga po, kung napapansin ninyo, in most hospitals talaga, before the patient can access his or her record, 'di ba kailangan mo ng dadaan sa pinaka-main system or doon sa pinaka-main na office kasi sila lang mismo nagbibigay nung authorized na medical abstract, mga ganyan. For incident reports or variance reports, this is a tool used as a means of identifying and improving the care. And in writing incident reports, this should be complete, accurate, and factual. Okay? These reports should not conclude opinions or interpretations. Ganyan. Hindi ka dapat naglalagay doon na, I therefore conclude, mga ganyan-ganyan, nagbigay ka na agad ng assumption mo. So, it's really a no-no to give your conclusion or assumption in the incident reports. So the report form should not be copied or placed in the client's record kasi there's an appropriate office for that. Hindi natin siya nilalagay sa client's chart or dun sa electronic medical record. Kasi yung electronic medical record is purely um, for the documentation of care, mga medication treatments na nagawa sa pasyente. For the incident reports or variance reports, may another system for that. And it is not suitable for a complete entry in the client's record regarding the incident. For controlled substances, nurses may administer controlled substances such as their narcotics, depressants, stimulants, and hallucinogens. Okay, only under the directions of the physician or any other authorized healthcare provider. And take note that these controlled substances must be kept securely locked and only authorized personnel should have access to them. In reporting responsibilities, the following situations need to be reported to the local authority, and this is a law. Failure to report any of these situations is considered as a malpractice. Yan. So, for example, mga communicable diseases, kunwari nagkaroon ng abuse. So, kapag hindi po tayo nag-report ng abuse, it is, we can be sued, okay? And, itong mga to, kailangan na i-report din itong mga okay, itong mga situations na ito. Assault or homicide, okay, hindi pwedeng itago lang natin on our own. For clients advocacy, This involves concern and actions on behalf of another person in order to bring about change. There are three elements of advocacy. Ano yung mga yun? We have the mediate, inform, and support. Okay? What are the difference or what are the differences ng mga ito? Mediate. When we say mediate, ano po sa tingin ninyo? Mediate as an element of advocacy, Kuya Jax? Mediate as an element of advocacy. Hmm. What does it mean when we say mediate advocacy? Mediate from the word mediate. Middleman. Yes, or ikaw yung pinaka main person for I mean to assist in negotiation in a certain health scenario. How about inform as an element of advocacy? Paano example po niya? Inform. Ano example usually ng mga pwede nating i-inform as an advocacy for clients advocacy? More on mga health education. How about support? Support. Support. Support as an element of advocacy. Mm-mm. Like what? Supportive. Mm. Mm. Okay. Sige. Another specific example with this element of advocacy sa support. For example, a patient is on rehab. So as a client advocate, we are the ones who will remind the patient kung kailan ulit yung next na rehab niya. So yun po yung specific example for support. Ayan. For inform, ayan, ano to, inform natin sila kung kailan din yung mga follow-ups, mga ganun. And for the mediate, this is more on the mediation or negotiation sa client's case. Ayan. We have moral principles. Yan. Kasama ito sa ano. Naalala niyo pa ba yung discussion noon nung undergrad ng nursing ethics? Ganyan. Naalala ko na ang teacher ko nun si Ma'am Pashal eh. Ayan. So for the moral principles, we have the beneficence. So it means doing good and promoting good. Yan. So ano yung mga example niya? Example niya, mga administering pain medications, yan, or practicing asepsis to prevent infection. Yan. So ibig sabihin kapag ginawa mo ito, 'di ba, you are really doing good and you are promoting good and really provides an excellent care or service din sa pasyente. So that is the beneficence. So also is included here is the promoting of safety, okay, and psychosocial support to an anxious client. Ano pinagkaiba naman nila ng non-maleficence? Non-maleficence, sorry for the wrong spelling. Okay, so it means to avoid doing harm, to remove from harm, and to prevent harm. Yan. So, iwasan mo na, na magkaroon ng hindi magandang pangyayari, okay, dun sa pasyente. Example of this is protecting the client from a practitioner who practices drug abuse. Ayan. So, another example is if you are reporting a certain incident, like for example, may assault or kaya nagkaroon ng abuse, okay? So, kapag ginawa mo yun, that is a principle of non-maleficence. How about for the autonomy? This is the right to make one's own decision. Yan. Autonomous. Fidelity, ano naman po yun? Yan. Mga faithful to the agreement and promises. Kapag sinabi ng supervisor mo na ikaw yung mag-check kung talagang binibigay ba ni Jessica, ni Nurse Jessica yung medication ng tamang dosage, mga ganyan. So ano pa ba yung mga pwede na familiar din sila with when it comes to their law. Ganyan. So for libel, this includes defamation by means of print, writing, or pictures. Yan, mga libel yan. For slander, this is a defamation by spoken word. Kapag may mga sinabi ka sa pasyente na na sobrang nakaka-humiliate, ganyan, humiliating words. Tapos, nasaktan mo talaga siya, so pwede kang kasuhan for slander. For fraud,
This is the willful, purposeful mispresentation of self or an act that may cause harm to a person or property. Yan. Invasion of privacy, this is a disclosure of any confidential information with regards to the records of your patient. Yan, pwede kang makasuhan dyan kapag shinare mo yung mga pertinent information, even the address or even the contact number ng pasyente. So, it's a no-no. And for the false imprisonment, this occurs when a client is not allowed to leave a healthcare facility when there is no legal justification to detain the client. Yeah. We have two. We also have the unintentional torts. Okay, we have two. We have the negligence and malpractice. Ano pinagkaiba nila? For the negligence, this is an act of omission or commission. So there is a mistake. Okay, meron ka talagang nagawa. For malpractice, okay, this is the negligence in the practice of profession. For example, you are in the operating room and mag-close na kayo, okay? Pero nung ikaw ay nagbilang for example ng instrument, okay, kulang yung yung nabilang mo, okay, nagkaroon ka ng pagkakamali with regards to the number of sa instrument count natin, and even in the sponge count. So pwede ka ma-sue or pwede ka makasuhan for malpractice. And to prove malpractice, there are 4 elements. So para ma-consider siya as malpractice, dapat present tong mga to, or these factors are very important. So, first is a duty of the nurse to the client, breach of duty on the part of the nurse, an injury to the client, lalo na kapag sponge count, tapos biglang nung na-close na yung nag-suture na, closing na nung physician, or I mean nung surgeon, tapos biglang nung in-x-ray siya later on or parang nagkaroon siya ng bleeding, yun pala nalaman na may naiwan na sponge or instrument sa loob. So that is considered as a malpractice. Kasi nag-cause tayo ng injury. Okay? And another factor is a causal relationship between the breach of duty and the client's subsequent injury. Yan. So, what are the different potential malpractice situations in nursing? Mga medication error, ganyan, sponge count, burning a client. For example, yung naka-IV, di ba? Meron silang, sa IV site yan, nagkaroon ng inflammation. So, pwede pa rin ma-consider yun as malpractice for the nurse. Kasi syempre, as a nurse, we should really provide care, not harm to our patient. So, dapat chine-check natin yan from time to time. Okay? Or client falls, pwede rin tayong kasuhan dyan for malpractice. Okay? Mistaken identity, loss or damage of client's property, and failure in reporting crime, torts, and unsafe practice. Ayan. And in here, take note that own the task, not the accountability, may be delegated to another nurse, okay, or another provider. Yan. So it's always the best practice here is to always ensure safety. Okay, dapat provision of safety is still the topmost priority when we are providing care to our patients. Ayan. For the death and dying, yan. Sino pong nagpa-pronounce ng death? NCLEX question din yan. Sino po ang mainly responsible in the pronouncement of death?
Doctor.
Okay. So, in the pronouncement of death, okay, in some states, there may pronounce death at the bedside, okay? However, the physician has the legal responsibility of pronouncing a person dead, okay? To be safe in answering, always choose physician, okay? So, and further, right of informed refusal, okay? A competent adult has the right to refuse treatment even in life-sustaining treatment. So we have here a DNR order. So this is a written order, okay, that must be present and must be reviewed on a regular basis. And the client or his or her legal representative must provide informed consent for the DNR status, okay? Ano ba yung mga examples nun? Di ba yung both DNR and CPR must be clearly defined so with the other treatment. So, what is euthanasia? Euthanasia is the physician or nurse caused death, okay, active euthanasia. Pinapractice ba nila sa US? Yes. And this, guys, take note that this is considered as a murder, okay, in all states, almost in all other countries. Ayan. So, for the death certificate, the physician is responsible for signing a death certificate. Hindi po mga nurse, okay? And for care of the body, dun na. When it comes to care, dito na tayo papasok, wherein we are mainly responsible for preparing the body for the morgue or the mortuary. Okay? And take note that in providing care to our patients, it is still best for us to consider the cultural practices of the patient. Ayan. For rigor mortis, this is considered as the stiffening of the body, and this usually occurs 2 to 4 hours. Okay? Kaya nga 'di ba, once na nagkaroon for example ng CPR, ganyan nag-code na tapos biglang wala na talaga, sinabi na rin ng family na stop na ganyan kasi syempre na nakakaawa na rin yung pasyente. Anong ginagawa natin as a nurse na providing care, 'di ba? Kin-close natin agad yung mga nila, 'di ba? Yung mouth nila kasi once na iniwan mo na na-open yan for more than 4 hours, mahirap na siyang ibalik. Okay? And in here we have the algor mortis, wherein this is the decrease in the body temperature. Yan. So, dito po, nag-decrease yung body temperature nila ng mabilis. So, 1 degree Celsius per hour. For livor mortis, ano po ito? Ito naman po yung sa skin. Okay? Anong nangyayari? There is a discoloration of the skin because of the breakdown of the red blood cells. Okay? Siyempre, namatay na yung patient, wala ng proper oxygenation, so mag-iiba na rin yung color ng pasyente. And we all know that the RBC is mainly, di ba, ano ba yung main function ng RBC natin? Our RBC is mainly functional for the, ano po, RBC function, it provides or it carries oxygen. Yan. Okay? So, as a management, we should make the body appear natural and comfortable pa din and allow the family to view the patient's body. Diba, usually, after arrest, ang ginagawa, so we will still allow the family to hug the patient, ganyan. But, since we are fully knowledgeable na pwedeng na mabilis mag-decrease yung kanyang body temperature and mag-iiba yung color ng skin niya, tayo na din mismo magsasabi sa family members na kailangan na tayong mag-provide ng care dun sa, na mag-provide ng post-mortem care. Okay? And place the body in supine positions with the arms at the side and palms down. Palms down. Okay? Take note of that. Place 1 pillow under the head and shoulder to prevent blood from discoloring the face. Ayan. Ayan, naglalagay. Kaya pansin nyo, di ba, naglalagay tayo ng pillow dun sa head portion para ma-maintain pa rin yung color ng face, ganyan, pag napunta na siya sa morgue. Okay? So, please absorbent pads under the buttocks to take up any feces or urine. Okay? And it's very important for us to apply any identification tags. Okay? And in here, isa po sa ankle and 1 on the wrist. Okay? So, this is also another NCLEX question. Saan po nilalagay yung identification tag? Nilalagay siya sa ankle and 1 on the wrist. Yan. And wrap the body in shroud and place the 3rd tag for identification. So, dito lalagay yung name. Ayun. Okay? So, tapos na po tayo sa ethical and legal, okay, as well as with cultural. For the leadership and management, in here, for the priorities of care, needs that are life-threatening are given highest priority. Okay, and take note, one of the test-taking strategies in NCLEX examination is to always look for the most priority intervention or most priority care that the patient needs. Okay, in addition, priorities of care, actual before potential concerns. We should really treat the situation first before proceeding the potential or yung mga possible pa na mangyayari afterwards. And we should always consider the time constraints and available resources. In addition, needs that are identified as important by the client are given highest priority. And gas na ito, di ba, yung based on priority, we usually use the Maslow's hierarchy of needs, kasi yun talaga yung standard, wherein we are giving high priority to the physiologic before the psychosocial needs. Ayan. And for the ABCs, yan, airway is always the priority. Diba? Airway, breathing, circulation. Yan. Unstable before stable clients. Client first before equipment. Ayan. And do not delegate clients who need to be assessed. Okay? Those who need health teachings, those who need to be evaluated, and those with unstable conditions. Okay? Next, for dehydration, transference of responsibility and authority for the performance of activity to a competent individual. So there are 5 rights of delegation. So first is right task. So dito, yung mga appropriate activities lang yung ating i-delegate. Right circumstances, ano yung ngayon? Right, for example, assessing the health status, okay? Right person, okay? Right direction of and communication, and recognition and evaluation. So these are the 5 rights of delegation. Right task, right circumstances, right person, direction and communication, and right supervision and evaluation. Okay? So, ito na po yung sinasabi ko sa inyo kanina na mga specific responsibilities per per profession. Okay? For CNA or unlicensed nursing assistant, so ito yung mga responsibilities nila, mga VS taking, di ba? Isipin na lang natin dito yung mga student nurses. Yan. So, di ba, allowed naman sila mag-VS taking, comfort measures, hygienic measures, may perform standard nursing procedures, mga standard, like ano yung mga standard nursing procedures, mga simple assessment, ano pa yung mga standard providing bed bath, mga ganyan. May care for clients with stable conditions. Take note, with stable conditions. Okay? Ano pa yung mga kasama dito? They can also provide activity, mobility, and exercise. Yan. As long as the patient is stable. Okay? Kasi ito yung mga unlicensed pa sila. Okay? For collection of specimen, as long as this nursing assistants or unlicensed nursing assistant will be supervised by the licensed nurse. Okay? Lalong-lalo na in the collection of urine. Kailangan sterile din yung di ba? For enema administration, pwede rin, and for obtaining equipment. Yan. For the LPN, yan, licensed practical nurse, they should undergo catheterization, pwede rin, and may care for clients with stable conditions. Okay? Yun. We also have these leadership theories. We have the bureaucratic, autocratic, okay? We have the laissez-faire, and the democratic. Okay na po ba or mabilis masyado? Okay lang? For the bureaucratic, this relies on the organization's rule and policy. Yan. For the autocratic, you should, as a leader na autocratic, you should really, you're mainly responsible in making decision for the group. For laissez-faire, you should recognize the group's need for autonomy and self-regulation, and dito gumagamit po tayo ng hands-off approach. Okay? For democratic, you are asking for the decision, or I mean, you're asking for the suggestion of the body, ganyan. So, kailangan consensus, ganun, kapag democratic. For the principle of management, we have authority, accountability, and responsibility. For authority, you have a legitimate right to direct the work to others. You're authorized to provide, I mean, you're authorized to give a certain task to your staff nurse. Ganyan. For accountability, you have the ability to assume responsibility for one's action and its consequences. As a head nurse who is accountable to your staff nurse, kung ano man yung nagawa niya na action, tapos nagkaroon ng inappropriate result sa pasyente, syempre, you're still, madadamay ka pa rin. Ganyan. For the responsibility and obligation to complete a task, kailangan tapusin mo talaga yun kasi you are mainly responsible for that. Like, for example, giving medication, ganyan, or ano pa ba yung example neto? Responsibility mo na tapusin yung tasking mo for scheduling, mga ganyan. For the principles in rooming in, we have here, okay, for cohorts, this is similar, okay, medical diagnosis or mode of transmission of disease, and may be roomed in as long as one does not have another type of contagious infection. So, ano yung mga considerations natin dito? We should consider the age and gender of the client. Clients of the same age group and gender may be roomed in. So, pwede silang magkasama. Clients with airborne infections should be confined in private rooms. Take note, mga airborne infections, okay, kailangan sila ay nasa private room. Of course, to prevent contamination. And for the immunocompromised patients, yan, they should not be roomed in with clients who have infections kasi nga mababa yung immune system nila. Syempre, they are very susceptible to infection if ever kasi hindi kaya ng kanilang immune system na malabanan if ever magkaroon ng attack sa kanila. Okay? For case management, this is an assignment of healthcare provider to assist a patient in assessing health and social service systems to secure that all required services are obtained. Okay? So, sino yung mga nag-require ng case management? These are the following. Persons age 65 with chronic diagnostic state and they live alone. Okay? For a newly diagnosed diabetic patient. For a patient who has a limited income, preventing prescription purchases. Yan. Confused or unstable to make decisions, weakness related to CVA. Ano yung CVA? Ano yung CVA po? Weakness. Cerebro. CVA. Cerebrovascular accident. Yan. Okay? So, it is also, for patients needing medical equipment, yan, sila din po yung mga kailangan ng case management. Yung kailangan mong mag-assist. Okay. Para ano po tayo dito, yung mga nasa social service, yan. Di ba yung usually mga nire-refer sa social service, ito yung mga examples po ng patients. Okay? Yung mga patients na na-confused or unable to make decision kasi sila lang yung nakatira sila lang yung na mag-isa lang nila, yung mga yon. So, kailangan tayong mag-provide pa rin ng assistance with these types or with these situations. Ayan. Okay? So, basahin nyo na lang po yan later. Ayan. Okay? So, let's proceed now to the discussion on pharmacology concepts. Okay? Okay pa po kayo or gusto niyo mag-break ng konti? Okay. Sige. Ay, okay. Okay. Window. Yan. Ito very exciting itong pharmacology kasi sinearch ko rin yung mga mga images ng mga herbal medications na meron sa sa US. Tapos very exciting talagang tignan. Ayan. Okay. So ay, nawala ba si Ma'am Jess? Ay,
Nawawala yung internet ko. Parang ano pa to eh. Ano to? Epekto nung bagyo.
ay, hindi natin na-record, no? Ah, okay. Sige, sige. Okay, so what are the different types of doctor's order? Yan. So, standing order, yan, it is carried out until the specified period of time or until it is discontinued by another order. Yan mga, yun yung standing order natin. Single order, carried out for one time only, yung mga medications na binibigay lang ng minsanan. Ano mga example po nun, Ma'am Jess? Mga single order natin na medications. Single order medication.
Gusto mo yung ano?
Usually yung mga
Ano ba usual nito? Usual nito, kunyari for operation, yung patient, yung mga PPI. Ano po yung sabi ko? O, PPI na med, prior to NPO, and then, sometimes antibiotic na loading dose bago OR.
yeah. Oo. Tapos ano pa ba? Yung usually standing order. Sige, start sa standing order. An example ng mga paracetamol, di ba? Yung mga, or kaya yung mga initial antibiotics, ganyan. So, standing order. Yung single order, yung ni Ma'am Jess. Stat order. Ano yung stat order? Kinakailangan nang ibigay. Anong example niya? Stat order? Medication?
Example ng stat order. Ano? Ano ba yung example ng stat? Or hindi ko maisip.
Kailangan ibigay agad.
Sila ng paper yan. Stat agad.
Or kaya yung pasyente nagkaroon ng attack, severe attack, tapos meron siyang, 'di ba, meron siyang pneumonia, ganyan. Tapos nagkaroon ng severe attack, stat order yung bronchodilator niya, mga ganyan. PRN order, so ano nga ulit yung meaning ng PRN na mention ko kanina?
Yung
PRN stands for
sinagot po ni JP sa chat.
ay, hindi ko nakikita, sorry. Naka widescreen ako. Sensor. Aray. Masakit na ignore, charot. Okay, so, what are now the different part of legal doctor's order? Yan yung mga kasama doon para maging consider as legal document or legal orders. Kailangan din pasyente, date and time, the name of drug, okay, the dose of the drug, mode of administration, times or the frequency, and the signature of the physician. So, kapag nagkaroon ng, kapag may component dito na wala, so this will not be considered as a order or legal doctor's order. So what are the principles in administering medication? So we have the following: we have the right drug. And take note that in here we should read the label 3 times. Okay? Kailangan 3 beses mo siya basahin para maging sure na tamang medicine na maibibigay mo sa pasyente. Okay? In the clinical area, do we do that? Guilty, no? Minsan hindi. Parang minsan makikita mo, ay yun, familiar ka na kasi familiar ka na sa sa kulay niya, familiar ka sa kung ano yung, di ba, yung itsura niya. Kaya minsan, ito, alam ko ito. But based on theory or based on standard, you should really read it, okay, 3 times. For the right dosage, we should know the usual dose of the drug and calculate the right amount, okay? Right time, standard time may be followed in the institution. So this is based on agency policy. For the right route, check for the route of administration kung yan ba ay parenteral or yan ba ay oral, mga ganyan. Right patient, first check, how do we check the patient, okay, kung tama ba yun? By checking the identification bond, okay? And take note that this is the most accurate patient identifier, okay? And aside from that, we should also ask him or her to state her name, okay? But, hindi ito in-advise as the best answer kasi this is not applicable, especially for conceived clients. Diba? For example, si Kuya Jax, disoriented siya sa time, sa place, ganyan. Kasi meron siya ibang iniisip, ganyan. Tapos, ikaw magbibigay ka na medication sa kanya. Tapos, ang ginawa mo, you did not check you did not check the identification one, issue nasa list, di ba? Ang ginawa mo, tinanong mo siya, anong pangalan mo? Tapos sinagot niya, ibang pangalan. Pero binigay mo pa rin. Siyempre, nagkaroon ka na ng violation sa law, pag gano'n. Okay? So, the best answer is still to check for the identification bond. Okay? And right recording, you should find the medication sheet immediately after administration of the medication. And of course, right approach. Okay? Take note that in catering to our patients or in caring for our patients, establishment of trust, okay, or rapport is very important. Okay? Second is for us to always practice asepsis, wherein kasama dito yung washing of hands before and after preparing medications. Take note that for nurses to administer medications, okay, we are mainly responsible for our own actions. Okay? So question and order that considered correct, okay, maybe unfair or inappropriate. So we should be knowledgeable about the medications that we administer, kaya nga magandang training tara, especially for the students to always provide drug recitation, di ba? Before sila magbigay ng gamot sa pasyente nila, kailangan i-recite muna sa CI. So, talagang ngayon nakita ko talaga na magandang training yun for them. Kasi may mga ibang estudyante hindi nila masyadong na-appreciate. Yung kailangan pang i-recite, mga ganyan. Okay? Yun yung purpose nun. We should really be knowledgeable, okay? Kasi kapag lagi natin sinasabi, mas mabilis din nating naalala, okay? We should know the actual indication, nursing responsibilities, and side effects of the drugs. Take note, this is a fundamental rule. Never administer an unfamiliar medication, okay? Kapag hindi ka familiar yan, wag mong i-administer. Do a comprehensive research first, okay? Third is, you should take narcotics in lab place. Fourth, use only medications that are clearly labeled in a clearly labeled container. And relabeling of drugs is the responsibility of the pharmacist. Take note, this is the responsibility of the pharmacist and not the responsibility of the nurse. Okay? Return liquids are before administering any medication. Okay? It is very essential for us to always identify the client correctly by checking the identification. But next is, do not leave medications at the bedside and stay with the client until he actually takes the medications. So marami tayong question about this na naibigay ko in the past. Okay? Next, the nurse who prepares the drug administers it, okay, and only the nurse who prepares the drug knows what the drug is. Do not vet endorsement of medications, okay? Kasi kapag nagkaroon ng any untoward occurrences or ng side effect pasyente na binigyan mo ng gamot pero hindi ikaw nag-prepare, syempre ikaw rin yung labo doon. Okay? Now, if the client promise after taking the medication, anong gagawin? Report this to the nurse in charge or the physician. Okay? Para alam nila, you're aware, and malalaman din nila kung ano yung yung magiging action nila. And take note that if you're going to report the base incident to the patient or the supervisor, to the physician or to the supervisor, ano yung mga important information na kailangan nyo i-report? Kasama dun yung content. Okay, ano yung content? Kung kanyang VAMI-2s, yung bacteria medication or yung ibang kasama. Okay, yung mga kasama din po yun. Okay, the characteristics of the VAMI-2s should be reported to the physician or the nurse in charge. Okay, next, for people with medication, these are usually discontinued during the post-operative period unless ordered to be continued. Okay. When a medication is omitted for any person, record the fact together with the reason. Okay? Documentation documentation of is very important. So, when medication error is made, report it immediately to the nurse in charge or physician. Okay? So, these are important to para magkaroon ng appropriate action or measure agad. And this may prevent any untoward effects of the drug. Okay? If ever na mali yung naibigay mong medication sa pasyente. Okay? So, let's now proceed to the different routes of administration. Oral, this is considered as the most convenient and safe route of administration. Take note that we will not give this, we will not give medication by oral route to patients who are unconscious, okay, patients who cannot swallow, and patients who has increased sensitivity and patients who are VAMI. Okay? So, this is the most common. However, the onset is slower compared to the other route. Okay? So, absorption will usually take in the GIT. Okay? We have certain types of oral drugs. We have solid and the liquid. Yan. Solid mga tablets, capsules, pills. Yan. And remember that the enteric coated tablet and time-release capsules are never crushed or chewed. Take note, the enteric coated tablets, okay, and time-release capsules are never crushed or chewed. Ano yung mga example ng enteric coated medication natin? Ano po yung mga example? We have the mga naproxen, ganyan, mga diclofenac, ano yung mga time-release? mga time-release capsules, ang mga example ng time-release capsules natin. Ano na to? Yung mga, wait lang, iniisip ko. Example ng mga time-release, medications, or yung mga control release. Ano na yung mga yun? Maging ako kayo, time-release. Time-release na medication. Wait lang, iniisip ako. Example ng time-release. Mamaya, pag maalala ko na example nun. For easy preparation, we have mga shears, mga syrup, mga suspension, yan. And take note that if you're going to read the label, it should other forms of oral drugs. We have the sublingual, nilalagay sa, it's placed under the tongue. Anong example na to? Mga katapos, di ba? Yung buccal, drugs that are placed in inner cheek. And this is the rule, never swallow the drug and do not follow with water. Pag mga buccal drugs yan. And if nitroglycerin is given, advise the patient not to smoke, okay? So, with regards to the safety in administering oral medications, so, ano yung mga dapat natin tandaan? This may actually cause aspiration and choking, okay? Especially pag yung mga ibigay nating mga medications ay mga malalaki, okay? That's why you should be assessed for the ability of the patient to take in the drug, okay? And we should also assess for drug reflex, ayan, if there is a dysphagia or altered loss of consciousness. Next is on NPO, yan. Siyempre, mga patients na scheduled for surgery, di ba? Usually NPO sila, tapos nabili oral medication. Siyempre, magiging liable ka na naman anong situation. And if the drug has an offensive taste, okay, offer oral hygiene. Habang lasa ng mga medication, di ba may mga rust-like taste na medications, and it's very important to provide oral care. Okay? Next is topical medication. This is like the skin. Okay? And take note that nurse should use gloves or should gloves when administering this type. Hindi pwede na gamitin lang yung ating yung index finger natin without using any other supportive material like yung gloves. Okay? So, donning the gloves is very important when administering topical medication. Next, for the inhalation medication, if that is a nasal inhalation, oxygen is administered by this route. Diba? So, we have the oral inhalation and the MDI or the metered dose inhaler. So, take note, as a standard, kapag yung patient ay MDI or ay may inhaler, it should be 2 inches away from the mouth, and patient should inhale it for 2 to 5 seconds. Okay, and then after that, we will instruct the patient to hold his or her breath for 10 seconds. Okay, and then before administering before letting the patient to inhale again, okay, we should wait for about 1 to 2 minutes. Okay, take note on yung mga important numbers dito should be 2 inches away from the mouth, okay, 2 to 5 seconds, and hold the breath for 10 seconds and wait for 1 to 2 minutes before each puff. Okay, hindi pa rin diretso. Okay, kasi ano pwede mangyari kapag diretso? Pwedeng mag-increase ang kanyang respiratory rate. Okay, yeah. Note, to know if the center is still packed with drugs, simply put it in a basin with water, and if it floats, it is empty. Okay, for nebulizer, we should dilute this to Ariel or yung 0.9 sodium chloride with an amount of 25 ml. And we should attach oxygen to nebulizer, okay, about 8 liters per minute. Breathe normally through mask or the mouthpiece for about 5 to 15 minutes. And as a rule, very important fundamental rule when administering nebulization is always provide oral care or oral hygiene to the patient. Ayan. For the eye medication or optic medication, ano yung effect niya? Dalawa, it can be miotic or hydriatic. When we say miotic, okay, there is a pupil constriction. And for hydriatic, there is a pupil dilation. Yan. It's hydriatic dilation. Okay. And we have 2 types. We have liquid and ointment. For liquid, take note that this should be administered at the lower conjunctival valve. And for the ointment, okay, it is administered from inner to outer canthus. Okay? Ano yung mga examples ng mga eye medications natin? Eye medications natin na topical. Examples? May maalala ka, Kuya Jax? Sorry, ikaw lagi natatawag ko.
Yung nilalagay sa baby?
Oo, nilalagay sa
Hindi ko kasi alam
newborn.
pangalan. Yung nilalagay sa baby, yun lang yung alam.
Ano yun?
Hindi ko nga matandaan, hindi naman ako pedya.
Ano? Ha? Ano? Starts with letter E.
Ends with letter. Char.
N. Ends with letter N.
Ano ba yan? Antibiotic ba yan?
Yes.
Ay, erythromycin.
Yeah,
Correct.
perfect. Perfect. Kasi, di ba, ang piniprevent nga natin is yung occurrence ng what condition? Kung maalala pa po ninyo, what condition we are
Oh my
preventing?
God. First
Yeah.
letter.
O.
Oh.
We are preventing the occurrence of,
Wait lang, two words ba to? Wow.
yes, two words.
Ginawang game. Oh, and then the second word starts with letters.
N.
Ginawang
N.
game. Oh, charot. Tag-invento. Wait lang. Um,
5, 4, 3, 2, 1.
oh my God, I don't
Mind
know.
Okay, so we are preventing the occurrence of ophthalmia neonatorum.
Oo nga. Yun nga.
Oo. Yun. Pag pumunta na po tayo sa MCN abnormal, so puro diseases na talaga, doon na yung management, ganyan. So note that in eye medication, we should not administer it to the cornea and press the nasolacrimal gland if the drug will cause systemic effect, and don't let the tip of the canister touch any part of the eye. Okay? And in here, sitting position is actually required. Okay? For example, you're assisting an ophthalmologist for an eye assessment. So, ano ang nursing consideration natin dito? We should dim the light prior to eye examination. Okay? For the ear medication, or what we call as the otic, okay, position dapat niya ay lateral. Okay? For the eye medication, ano ulit ang position ng pasyente? Ano po ulit ang position ng pasyente for eye medication?
Sitting, sabi ni
Yes, sitting. Ay,
Sabi ni
sorry,
Casey.
hindi ko nakita yung chat po eh. Naka-ano kasi ako. Okay, so for patients who are children, ages 3 years old, okay, and below, ano ang gagawin natin? How are we going to administer medication? We should pull the pinna down and back. Okay? Pababa at palikod. Okay? Para maalala po ninyo gawin nyo ngayon sa sarili ninyo ang for adult. Okay? How are you going to administer an ear medication to an adult? Adult. Okay? Paano mo ginawa, Kuya JP?
Sabi niya up and back. Cool. Nabasa ko lang.
Okay. Up and back. Perfect. Okay? Kasi baka si Kuya Jack ginawa niya down and back. Charot. Okay. And for the solution,
Sigurado down and back.
oh, joke lang. For the solution, it should be administered at the side of the ear, and the temperature of the solution should be warm, and press the tarsus of the ear 3 times for absorption. So take note, 3 times for absorption. Kasi kung hindi mo po hindi mo pinlas yung tarsus, nasa labas lang siya. So malamang hindi siya agad papasok sa loob. Okay? And place earplug for 5 minutes. Okay? In case na yung pasyente ay gumagamit, for example, ng hearing aid, mga ganyan. So, note, if the ear canal is obstructed by seed, don't flush with water. Okay? And if an insect goes inside the ear, use flashlight. Okay? Usually, ginagawa ng mga ENT specialist dito, they are using, alam mo yung parang chane, yan. So, tapos kinukuha nila. Yan. So, hindi, may mga ibang specialist din na fina-flash nila, okay? Pero based on standard, tignan mo muna. No? I-assess mo muna kung nasaan ba yung location ng foreign object or yung insect, for example. Next is the parenteral route. So, this is a medication administered using a needle. Okay? And usually, ano yung mga gauge natin? We have 25, 26, 27, mga ganyan. Take note that there's minsan may mga nalilito, French, ganito, gauge, ganito, ganyan. So, ilang inches naman. So, malalaman natin ano ba yung mga differences sa mga yun. Okay? Note that you should not massage the site of injection. So, to prevent irritation of the sites and to prevent absorption of the drug into the subcutaneous area. Okay? Do not massage. Take note of that. For subcutaneous route of medication administration, this is usually for vaccines, mga heparin, or preoperative medication, kasama din mga insulin or narcotics. Okay? So, for the site, this is located at the outer aspect of the upper arms, okay? Or usually sa anterior aspect of the thighs, abdomen, and sanpa. Scapular areas of the upper back, mga ventrogluteal or dorsogluteal, okay? And take note that only small dose of medication should be injected via the subcutaneous route, okay? And dito, okay, dito na po tayo gumagamit ng um, different um, gauge, di ba? Iba ang ginagamit natin na gauge if the patient is child, if the patient is an adult, and kapag continuous na continuous administration of medication, usually mga nagsa-sub-Q yung mga mga type 1 DM, di ba? So, take note that we should rotate the site of injection. Okay? For example, ngayon, in-inject mo siya sa right, okay? Sa right, sa right abdomen. So, kinabukasan naman, ilipat mo siya doon naman sa kabila, sa left. Okay? So, yun. Rotate the site of injection to minimize tissue damage. Okay? So, take note that for thin patients, ano yung angle ng ating needle kapag in-check tayo, it is 45 degree. Kapag mga mataba yan, mga obese, yan. So, 90 degree, okay, diretso lang. For heparin injection, take note that you should not aspirate and do not massage the injection site to prevent hematoma formation. This is for heparin injection, okay? For insulin injection, okay, do not massage to prevent rapid absorption, which may result to hypoglycemic reaction, okay? And take note, and you should always inject insulin at 90 degrees angle. Okay? 90 degrees angle po lagi kapag insulin injection yan. And, eto yun guys, we need to be reminded that we need to adjust the length of the needle depending on the size of the client. Yan. Next is IM. Yan. Yung mga needle length niya is 1 inches or 1.5 or 2 inches to reach the muscle layer. Okay? It's very important to clean the injection site with alcoholized cotton ball to reduce microorganisms in the area. And inject the medication slowly to allow the tissue to accommodate the volume. Hindi kailangan mabilisan yan kapag IM. Okay? So, there are various sites of IM medications. We have the ventrogluteal site. Okay? So, anong position ng patient kapag ventrogluteal? Position is in prone or side lying. Okay? Kapag yung pasyente ay in prone position, we should instruct him or her to curl the toes inward. Okay? Kapag side lying naman yung position ng pasyente, we should let him or her to flex the knee and the hip. Okay? So this will now ensure the relaxation of the gluteus muscles and will minimize discomfort during injection. Ayan. So, to locate the site, place the heel of the hand over the greater through canter. Patay nyo nga pong gawin. And then point the index finger toward the anterior superior iliac spine. Okay? And then abduct the middle third finger. Yan. So, kapag naka-form ka ng triangle, okay? So, the triangle formed by the index finger, okay? And the third finger and the crest of the ilium, that is now the site for the ventrogluteal. Okay? For the dorsogluteal, this site should not be used in infants under 3 years old. Bakit? Because the gluteal muscles are not yet well developed. Okay? So, very important dito is to avoid hitting the sciatic nerve. Okay? Since this is a major blood vessel or bone, okay, kapag na-hit po kasi ang sciatic nerve, the patient may be paralyzed. So, hindi talaga siya advisable na gamitin under 3 years old. Okay? For the vastus lateralis, this is the recommended site for infants. Okay? Vastus lateralis, and this is located at the middle third of the anterior lateral aspect of the thigh. Okay? And we should assume a back-lying or sitting position. Okay? Next is the rectus femoris site. So this is located at the middle third anterior aspect of the thigh. Okay? Deltoid site, not used often for IM injection kasi sa deltoid natin, there's relatively small muscle and it's very close to the radial nerve and radial artery. Ayan. So, anong pinaka-main na basis natin dito is to, this is approximately 5 centimeters or 2 inches or 2 to 3 finger breadths below the acromion process. Okay? Locate your acromion process. Okay? And then, just below it, mga 2 to 3 finger breadths, that's the deltoid site. Okay? Yan. Okay? Next, we also have the IM injection, yung Z-Track injection. This is used for parenteral iron preparation. Okay? And, anong ginagawa natin? Bakit tayo magamit ng Z-Track? the main purpose or the main rationale for this, okay, for the Z-trap method is to seal the drug, okay, and to seal the drug deep into the muscles and prevent permanent staining of the skin. Ayan. So, take note na ginagamit natin ito for iron preparation. I mean, to seal the drug, okay, para mas mapunta pa siya doon sa muscles, okay? And also to prevent staining the skin. So, ang ginagawa natin dito is to retract the skin laterally and injecting the medication slowly, okay? So, take note that you should not massage the site to prevent leakage into the subcutaneous area, okay? So, the following are the principles in parenteral administration. So, very important to check the doctor's order, checking for the expiration of the medication. Bakit? Kasi kapag expired na yan, this might affect the potency, okay? And, syempre, magbababa na yung effectivity niyan kapag expired na. It might also cause harm to the patient. Observe verbal and non-verbal responses towards receiving injection. Can be painful, and client may experience pain, di ba? Practice asepsis to prevent infection, and apply disposable gloves. Ideally, dapat talaga nag-gloves tayo if we are performing parenteral administration. And use appropriate needle size to minimize tissue injury. And we should plot the site of injection properly, okay, and avoid hitting the nerves. Ma, dapat tinanggal mo yung saksakan ng lubat to. Oo, may nalubat tong laptop. Nawala. Okay, and we should introduce air into the vial before aspiration, take note, and introduce the needle in thick thrust to lessen the discomfort, okay? Additionally, ito po yung mga principles niya. So, basahin, isan ko na lang po sa inyo later, okay? So, what are the different methods of drug administration? Yeah, a mixture of within large volumes of IV fluids. We have the piggyback infusion, a solution containing prescribed medication, and a small volume of IV fluid through an existing IV line. Okay? So, by injection of a bolus or small volume or medication through an existing intravenous infusion line or intermittent venous access. Or ito yung tinatawag natin na heparin lock, di ba? Yan. So, for drug administration that is given intravenously, this is considered as the most rapid route of lang po, manlulubat na kasi ito. Pero dito pwede magtakas dito. Wala yung saksakan dyan? Wala na emergency. Ikatak mo lang yun. Wala na emergency. Ito nga eh. Wala din. Saan ko pwede ilipat? Ito eh, extension eh. Ayan. Ito yung puti. Yung puti. Yung puti. Meron na ma? Nakapakpak naman yung ayun. Ayan, sorry po. Nandyan pa po kayo?
Present!
Yeah.
Present.
Okay. Saan na tayo? Okay, so, IV, ito po yung pinaka-mabilis, no? This is the most rapid route of absorption of medications. This is, this is predictable, wherein therapeutic blood levels of medication can be obtained, okay? And the route can be used for clients with compromised GI function or peripheral circulation, okay? So large dose of medications can also be administered using this route. And take note that we must closely observe the client for any symptoms of adverse reactions. Okay? And when administering potent medications, we should always assess the vital signs before, okay, during and after infusion, especially if the patient is undergoing blood transfusion. Okay? So these are There's interventions for IV infusion. Yan, verifying the doctor's order, na-mention natin kanina. Okay? And we have three types of IV fluids. We have the isotonic, we have the hypertonic, and hypotonic. Kapag isotonic yan, it has the same concentration as the body fluid. Okay? Ano yung mga examples ng isotonic solution natin? Mga D5W, mga sodium chloride, Ringer's lactate, and mga plain normal sol. Okay? Next is yung hypotonic. It has a lower concentration than the body fluids, and in here, too much of this fluid can actually swell the body cell. Okay? For hypertonic naman, these are fluids that has a higher concentration than the body fluids, and too much of this fluid can make the body's cell shrink. Ano yung mga examples ng hypertonic natin? Mga D10W, D50 water, D5LR, D5NM. Yan. Usually sa mga mga cases na nagbibigay tayo ng hypertonic solution. Maalala po ninyo? Ma'am Jess, hyperton cases.
Ano nga ba to? Wait.
Sige.
Ano ba to? Ba't nga ba ito binigay?
Bakit siya binibigay? Usually, yan, mga D50 water, di ba? Yung mga severely dehydrated, yan, binibigay natin yan.
Yan, naman si JP ko, JP.
Ano pa? Usually, if a patient is in coma, mga ganyan, tapos naka-mech vent pa siya, anong usually type ng IV fluid ang ibibigay? Hypertonic ba? Patient is in coma. Usually, hypertonic. Kasi yung mga pasyenteng yon, they actually lack a lot of electrolytes in their body. So, to replace it, kailangan nila ng hypertonic solution. Yan, okay? How about for hypotonic? Ano yung mga examples ng ng cases or illness na nagbibigay tayo ng hypotonic? Hypotonic. Example pa nitong mga hypotonic, yung 0.45, di ba? 0.45% normal saline. Ano po mga example ng cases? For example, yung pasyente ay merong diabetic ketoacidosis. Yan, wherein ang nangyari doon, yung intracellular niya, diba? Yung intracellular cells ng pasyente na may diabetic ketoacidosis ay nagiging dehydrated. So, kailangan magbigay tayo ng 0.45 na normal saline para matulungan yung cells na ma-rehydrate. Okay? So, yun. So, what are complications of IV infusion? We have the infiltration, wherein nakikita natin na naka-needle out na siya, di ba? Nakalabas na yung needle. And this is very painful to the part of the patient, okay? That's why, as a nursing intervention, we should apply cold compress, di ba? So, usually nakita natin, we should apply warm compress. And, ano pa yung, as part of our assessment, nagkakaroon ng skin discoloration, okay? Ano pa yung isang sign na nagkakaroon ng infiltration? Usually, hindi na tumutulo yung ating IV fluid, okay? So, those are signs kapag hindi na tumutulo or kaya, may pain na naramdaman yung pasyente, and there is also a, change in the color change in the temperature ng skin ng pasyente, we may consider that there's already an infiltration. And as a management, warm compress should be applied. Okay? Next is circulatory overload. Okay? So this complication of IV infusion results from administration of excessive volume of IV fluids. Anong usually mafe-feel ng pasyente? Usually mafe-feel niya na masakit yung ulo niya. And if you're going to check the blood pressure or the vital signs of the patient, there's an increased blood pressure, and usually nagkakaroon na ng syncope, okay? And nagkakaroon na rin ng faintness, okay? This might also result to shock. As a nursing intervention, anong gagawin natin dito is strict KVO. So, ang strict KVO natin is at least 10 drops per minute. And positioning of the client is very important. na dapat siya ay naka-high Fowler's position to facilitate the breathing of the patient. Okay? And also, take note na pwede tayo mag-administer ng medications that includes the diuretic or bronchodilator, but this should be ordered by the physician. Okay? Hindi tayo basta-basta magbigay without doctor's order. For the drug overload, this complication of IV infusion occurs when the patient receives an excessive amount of fluid containing drugs. Okay? So may kasamang may drug component dun sa IV ng pasyente. So ano yung pwede nating mapansin sa pasyente? Pwede siyang mag-verbalize na nahihilo siya or nagkaroon na ng shock. Sa nursing intervention, mag-KDO ulit tayo, 10 drops per minute. Okay, and we should take the vital signs and notify the physician. Okay, for superficial thrombophlebitis, so this is a complication of IV infusion that is due to overuse of a vein. Okay, example po nito yung chronic patients na nag-stay sa hospital for more than a month, tapos matagal na rin na naka-insert yung kanilang IV. Okay? So, there is a possibility na magkaroon siya ng superficial thrombophlebitis. Okay? Take note that as a standard, we should change the IV site every 72 hours. Okay? Pero, ang nangyayari kasi dito sa Philippine setting, hanggat nakikita mo na tumutulo pa yung IV, kahit na yan ay ilang days na hindi pa napapalitan kasi nga lalo na sa ibang government hospitals kasi may mga ibang pasyente or significant others na hindi na nila afford bumili ng another set. Okay? Pero as a standard, dapat pinapalitan talaga yan every 72 hours. Okay? Take note that we should also use large veins for irritating fluids. Hindi dapat siya sa mga small veins kasi mabilis yan mag-rupture. Okay? And stabilize venipuncture at the area of flexion. Dapat na i-move pa rin ng pasyente yung kanyang arms, no? Kapag nag-insert tayo ng IV. Okay? Apply cool compress immediately to relieve pain and inflammation and later with warm compress to stimulate circulation and promote absorption. Okay? And additionally, we should not irrigate the IV because this could push clot into the systemic circulation. May mga iba kasing ginagawa nila. Once na nag-stop yung IV fluid, hindi na nag-flow. Anong ginagawa? Di ba nag-aspirate sila ng fluid and then after that, ipupush nila. So, that is not actually a correct troubleshooting. Kasi may mga ibang ginagawa, lalo na kapag matagal na yung staff nurse, ganun yung pinapakita nila sa mga estudyante. However, in my experience as a clinical instructor, supervising my students, I usually tell them not to do it, lalo na kapag naging staff na sila, kasi that is not the proper way on how to troubleshoot those kinds of situations. Kapag hindi na nagfo-flow, hindi ka dapat mag-aspirate ng fluid, 'di ba, dun sa may port niya, tapos bigla mong ipupush. Kasi ang possibility nun, baka ang maipush mo yung clot, which would actually provide harm sa pasyente. Okay? There is also a complication of air embolism wherein the air is managed to get into the circulatory system. Okay? And take note that an amount of 5 ml of air or more will already cause air embolism. 5 ml or more, magkakos na siya ng air embolism, and this is already considered as a life-threatening condition. Okay? As an assessment, anong usually mapapansin mo? There is, upon assessment, there is tachycardia, no? There is increased venous pressure, and there might be a presence of dyspnea sa pasyente, nag-iiba yung kanyang color, may cyanosis na, and may loss of consciousness. Okay? So, as a nursing intervention, anong gagawin natin dito? We should not allow the IV bottle to run dry. Kasi nga, piniprevent natin na magkaroon ng, na pumasok yung air dun sa ating system. Okay? So, prime the IV tubing before starting infusion. Paano ba yung priming natin? Before we insert or before we hook, 'di ba, yung tubing dun sa may IV site, okay? Kailangan i-run muna natin siya at dapat makita natin na walang air na nagfo-flow dun sa tubing, okay? And we should turn the patient to the left, okay? In the Trendelenburg position. This will now allow air to rise in the right side of the heart and thereby preventing pulmonary embolism. Okay? So positioning again is very important to prevent air embolism. Anong position niya? Turning the patient in a left side in a Trendelenburg position. Okay? Yun. Next is the nerve damage. So this complication of IV infusion results from the trying the arm too tightly to the splint. Ayan. So, kasi lagi niyang nagagalaw eh. Usually sa mga sa mga bata, 'di ba? Ang ginagawa natin, naglalagay tayo ng mga splint para hindi nila ma-move um, ng madalas. So, kapag sobrang mahigpit naman yung pagkakalagay natin ng splint, this could actually damage the nerve of the patient. Okay? As a nursing intervention, we should massage the area and move the shoulder through its range of motion. Okay? And instruct the patient to open and close hands several times each hour. Okay? Pwede rin tayong mag-ask sa patient na kung meron silang stress ball, pwede nilang gamitin yon. And physical therapy may be required. And take note, apply splint with the fingers free to move. Yan. Dapat na move pa rin nila yung kanilang fingers. Okay? For speed shock, this complication of IV infusion results from administration of IV push medication rapidly. And to avoid speed shock and possible cardiac arrest, okay, give most IV push medication over 3 to 5 minutes. Hindi siya dapat mabibigay in less than a minute. Okay? Kasi ang possibility nito, magkakaroon ng ng cardiac arrest or magkakaroon ng shock. Okay? Kapag sobrang mabilis din yung pag-administer natin ng IV. Okay? So, these are examples of drugs, yung mga drug types, mga capsule, cream, mga elixir, extract, jelly, liniment, lotion, lozenge, ganyan. Ointment, pill, powder, suppository, syrup, and tablet. Okay? For the sublingual, yan na-mention na kanina, yan, do not swallow. Okay? For rectal, this is used if drug has a bad taste. And take note that if you're going to administer medication, okay, rectally, the absorption is low. Okay? Topical for skin, transdermal, semi-permeable, sub-Q, faster and expensive than oral. Okay? For this use for small volumes only and slower than IM. Okay? Naalala nyo pa, for sub-Q, insulin injection, ano ang nursing consideration natin dito? Rotate the injection sites. Okay? How about for thin? For thin patients, what is our what is the degree? If we're going to inject the needle, thin patient, payat. Ano po?
45 hours.
Yes, very good. 45. How about for obese patients?
90.
Yes, and for heparin injection, anong nursing consideration natin?
Do not massage.
Yeah, okay. Okay. So IM for large volumes and rapid absorption. ID or intradermal for slow and pag gusto nating mabilis, fast absorption, mag-IV tayo. Okay? So this is the yung from fastest to slowest absorption starts from IV. Next is yung sublingual, IM, sub-Q, and last po yung oral natin. Okay? So these are the different mga standards, okay, for inserting or injecting a needle to a patient. Okay? For IM, yan, gauge 24 to 25 for a child and gauge 23 to 24 for an adult. Okay? So tips, ito na yung sinabi ko kanina, maraming mga nalilito. For French, okay, this measures the outer diameter. Diba? Yung outer diameter ang min-measure nito. Kapag inches or millimeter, it actually measures the inner diameter. And for gauge, this is for needle sizing. Yan. So pag tinanong, what is the gauge of the needle if you're going to insert or if you're going to inject to a child? Ano? What is the gauge of the needle if you're going to inject in a child? Ano ulit? Ilan? Standard?
26 ata. 26,
For a child?
Child ba?
Child.
Joke lang, 24. Ay, hindi, wait lang. 24, 25, 26. 26 yung namin namin eh. 26, 37. 5, 6, 7. 6?
24, 25. For IM.
4,
For
25.
IM. For IM. For IM, yeah. For ID, 26, 27, usually engaged dyan. Sub-Q, 25 to 26. Ayan. So, ito yung mga different, so pag pag kukuha tayo ng medication, we can use the ampule, vials, ophthalmic meds, otic, yan. So, next is the blood transfusion therapy. Kaya pa po? Kaya pa?
Yaha, kaya po.
Okay, so what are the objectives of blood transfusion therapy? So, we have three, okay? To increase circulating blood volume after surgery, trauma, or hemorrhage. Okay, next is to increase the number of RBCs, okay, and to maintain hemoglobin levels in clients with severe anemia, and to provide selected cellular components as replacement therapy. Okay, for example, meron siyang problem when it comes to clotting, mga ganyan. So, yun yung mga instances na kailangan nating mag-provide ng blood transfusion. So, who receives blood? These are patients suffering from severe blood loss, mga may leukemia, hemophilia, mga mothers giving birth with
patients and mga patients undergoing transplant. Okay? So, these are the types of blood products that are used for transfusion. Take note that in a certain product, okay, magkakaiba yung infusion time. Okay? That takes 15 to 30 minutes, dun nag-occur yung mga transfusion reaction. Okay? So these are the transfusion reactions that might occur. There could be an acute hemolytic reaction. As I've mentioned earlier, this occurs 5 to 15 minutes after the initiation of transfusion. Okay? Anong management natin kapag nagkaroon na ng ganito? Stop the transfusion immediately. Okay? Start NSS ka na or lactated ringer solution and consider diuretics. Okay? As ordered ito. And for example, if the patient is already febrile non-hemolytic, this occurs within 30 minutes, okay, of transfusion to 6 hours after transfusion. Kaya dapat minomonitor pa rin natin yung vital signs post-transfusion. Okay? So, dito, stop pa rin natin yung transfusion and administer antipyretics as ordered and monitor the temperature every 4 hours. Okay? And para maalala po natin, we have here the transfusion reaction. Reaction R for rashes. Okay, E for elevated temperature. Ito yung mga kailangan natin i-watch out. Okay, A for aching. C for chills. T for tachycardia. I for increased respiratory rate. O for oliguria or anuria. Okay, or N for nausea and vomiting. Okay, kayo nga po, ano nga po ulit yung different transfusion reaction, okay? Without looking, without looking at the notes, ano po yung ibig sabihin ng reaction? Kailangan nating i-watch out. Reaction, okay? Checking for
Iikot to,
the...
diba? Mauna na ako.
Okay.
Rashes. Smart ako
Okay.
eh. Next.
Next.
Hoy, boys, ang daya nyo.
Next.
Volunteer po. Jax po.
Next. Reaction. E
Tingnan mo,
for...
may ikot yan eh. Mauuna ako eh. R. Di ba
E
R,
for...
rashes? Susunod ka na.
E for... Sige na nga, para matapos na. E for elevated temperature, A for aching, C for chills, T for tachycardia, okay? I for increased RR, O for oliguria or anuria. Ano yung oliguria? Sige, yun na lang. Oliguria means
Hindi umihi. Unti na ihi.
urine output less than 400 ml. Okay? 400 ml or less than 20 ml per hour yun. So, how about tapos meron ding nausea and vomiting. Okay? So, the first thing to do when complications in blood transfusion occur is to stop. Okay? Then start an IV line or open IV line using 0.9 sodium chloride. Position the patient in a Fowler's position and administer oxygen therapy. And this depends on the hospital protocol. Check the vital signs as often as 5 minutes and notify the doctor immediately about the complications of the blood transfusion. Okay? So, to rin po, carry out the doctor's order, obtain the urine specimen, and send to the lab, okay, to determine presence of hemoglobin as a result of RBC hemolysis or destruction, and the blood container, tubing, attached label, and transfusion record are saved and returned to the laboratory for analysis. So, hindi siya basta-basta tinatapon lang. Kailangan i-save siya at ibalik sa lab for analysis. Okay? So, basic requirement of a potential blood donor. Weight should be at least 50 kilograms, ayan, or 110 pounds. The blood volume collected will depend mainly on your body weight. Pulse rate should be between 60 to 100, normal. Regular rhythm. Blood pressure should be between 90 and 160 systolic and 60 and 100 as the diastolic. Okay? Hemoglobin should be at least 125 grams per liter. Okay, who can't donate? Ito yung mga may recent STI, mga patient with tattoo, pregnant women, hypertensive patients, patients with bleeding conditions is LH and FSH is mainly functional or mainly important for a menstrual cycle to take place. So, yun. So, this relieves PMS, dysmenorrhea, okay, infertility, or menopausal symptoms. Cranberry, yan. Ito nakikita natin sa grocery, right? So, this is a prophylaxis for UTI, okay? And treatment for premenstrual syndrome, okay? Diabetic neuropathies, chronic inflammatory conditions. Yan. May yung hawthorn, meron din tayong hawthorn. This promotes peripheral vasodilation and increases coronary circulation and acts as an antioxidant. Yan. Mahilig sila sa mga herbal supplements doon. Okay? So, yun. So, we will end our discussion dito po sa herbal medicines and I will post questions tonight. So, for now, let's rest po muna and gusto niyo ba mag-answer tonight? Post ko, no? Post ko yung questions before po kayo matulog, i-answer niyo yung mga questions. Tapos, try nyo i-time yung sarili ninyo na as much as possible per item, dapat masagot nyo siya in a minute. Okay? Yun. Para lang ma-assess ninyo. Okay? Okay. Sige po.
Hoy, teka lang, ipopost din ba tong material on herbal medicines?
I-post ko.
Hindi ko na-copya lahat. Wag kang Jack. May post
Ayun.
mo ba?
Sige. I-post ko na lang. Para mag-review muna kayo.
Okay, thank you.
Okay, sige. Bye-bye. Bye po. Okay, bye-bye.
Bye-bye.
Bye-bye.